I've treated acne scarring in a 70-year-old man. And I think the main lesson here is that acne scarring causes an enormous amount of kind of psychosocial distress. And we need to treat acne as aggressively and effectively as possible because acne may be for a limited period of their life, but the scars are forever. And they are so complicated to treat. It is not uncommon for me to use a vascular laser or an IPL device, as well as a radiofrequency microneedling device, and then a fractionate laser, all in the same treatment.
Hi, skin friend. Thanks so much for tuning into this week's episode of The Skin Rail. This week, I'm so excited to have my colleague on, Dr. Chris Adigun. She is a board-certified dermatologist and a leader in lasers and aesthetic medicine. She practices at Dermatology and Laser Center of Chapel Hill, where she has assembled her dream team of top dermatology professors and has so many unique lasers and devices to help treat her patients many cosmetic as well as medical skin concerns. And she really is a key opinion leader in the laser space and is so knowledgeable in this area. And I'm so glad she's going to share with us what are lasers and also energy-based devices and what can they be used to treat for, what's kind of hype and what's not, and what some of her favorite devices are for certain skin conditions. If you have ever thought about getting a device or laser procedure, you're definitely going to want to stick around for this episode. Dr. Adigun, thank you so much for being here. I'm so excited to have you share your wealth of knowledge about lasers and also energy-based devices. So thank you so much for being here.
Thank you for having me.
Now, I introduced you briefly in the intro, but I would love for the audience to hear who you are, what you do in your own words.
So yes, my name is Chris Adigun. I'm a board-certified dermatologist. I have my own practice, the Dermatology and Laser Center of Chapel Hill in Chapel Hill, North Carolina.
Do you see patients of all ages, or is there an area of expertise that you have?
I do see patients of all ages. I'm the Dermatology and Laser Center, so clearly a focus is laser technology, and I have a whole host of energy-based devices and many different lasers. So we're often using technology, whether we're treating vascular birthmarks on a baby or I'm doing, deep field resurfacing on a patient for their wrinkles. So really kind of doing all the things that lasers can do.
Yeah, and that's what I think is so cool about our field and what we do and also the technology that we use. It's not just cosmetics, right? I think people think lasers are just for people wanting to get rid of wrinkles or look better. But like you mentioned earlier, we use lasers for a number of medical things as well, like vascular lesions, birthmarks. Even nowadays, skin cancer can be treated with a laser.
I do that as well. Yes.
Yeah, well, I'll definitely want to talk about that. But let's just start at the basics, the very basics. What are lasers, right? I think people hear that term. I think of Austin Powers and sharks with laser beams, but what are lasers?
So a laser is really an acronym for light amplification by stimulated emission of radiation. So it's really, laser is a lot easier to say than all of that, but I really think of it as an intense beam of monochromatic light. And when I explain that to patients, I say it's one wavelength. We just are using one wavelength to do exactly what we want it to do. But that being said, why do we have so many lasers? Well, we need all these different wavelengths to do exactly what we want them to do. And it kind of depends on what we're treating. I think it can be simplified a little bit when you think about what the dermatologist will call the electromagnetic spectrum and what wavelengths are absorbed by what chromophores in the skin. Now, I don't use the term chromophore with patients. I call them our targets. What do we want to absorb the laser energy? Well, we want to use the wavelength that is absorbed by that target most. And the targets that we use in the skin are melanin, water, and hemoglobin. Most often, I would say melanin and hemoglobin, and then water when we're doing resurfacing. So if I want to treat birthmark, a capillary malformation on a baby or sometimes an older adult, then our chromophore that we're targeting is hemoglobin, and that's going to absorb that laser energy while the rest of the skin is left totally intact. So it allows us to be incredibly precise. And I think that's why we love lasers so much.
What a great synopsis, right? Because it can get really technical, lots of physics involved. I think people think, oh, laser, right? You just click a button and the screen tells you what settings to use and all. But really, it's so much more than that because people are not just cookie cutter, one size fits all. And you really need to understand the physics behind this and understand how lasers work to get the best results. So it's so much more than just clicking a button, right?
You know what also is kind of funny, Dr. Mina, is when patients come in and say, oh, I don't want to do laser. My friend did laser, right? Because they think laser is one thing rather than many, many different wavelengths, many different energy levels, different ways that we use it to treat different problems. So that's a common misconception that laser is the same thing.
Yeah, like one device, like this is the laser. It's so important that we know what chromophore, as you call it, target that we're treating because if you have brown spots on your face and you see someone who is offering you a laser where the target is hemoglobin, a vascular laser, you're going to not get the results you want. And then another important thing, right, is say things like laser hair removal, right, where the target is melanin or pigment and if you have a lot of white hair, is that laser gonna work?
Not going to work. No laser hair device or no laser will work on any white hair.
Yeah, and then the other issue, right, like with laser hair removal, right, is that if you have a tan or if you have darker skin, if you don't use the appropriate laser, guess what? The laser sees the melanin in someone's skin, whether that's your natural melanin or a tan, and you can actually get lightening of the skin. Do you ever see that or hear about it?
Yes, I mean, I've tried to really be like a good member of the community here in the Greater Triangle region, which is kind of Chapel Hill, Raleigh, Durham, this whole area. So, and what I mean by that is that I want to be a safe place for other practices to call to manage complications. And I think that I see more complications with laser hair removal than maybe anything else. It seems so like it's some kind of, easy commodity that you can go into any one-stop shop to get your laser hair removal, but I see more complications from laser hair removal, I mean, by far. Burns from a tan, like you said, or just the wrong wavelength with the skin type. You need to use a very long wavelength if someone has deeply pigmented skin, because when we bypass the pigment that's in the surface of the skin and only treat the melanin that's in the bulb or the bulge of the hair follicle. But people can get that mixed up.
And unfortunately, I feel like laser hair removal, it's everywhere. Every place is offering it, right? I'm just waiting for CVS to start offering it. And it seems like, oh, well, everyone's doing it. It must be easy. But, maybe if you are as pale as I am, it's hard to really lighten this skin. But, for most people or people who have tans or darker skin, it really can leave complications. So yeah, and it doesn't always go away, right? Sometimes it does, but not always. So, yeah, laser hair removal, I think, is one of those that people just have this sense of, oh, it's so easy. Everyone does it. But
Yes. Another one, Dr. Mina, is our IPL devices. That's probably my second most common complication that I manage are IPL burns.
let's talk about IPL. Is that a laser?
It is not a laser. IPL is what we call a light-based device because it actually emits many, many wavelengths of light. It's really a whole band of light. It's a wonderful device and can treat a lot of different concerns because it's treating such a broad band. So you're able to get some of the melanin, some of the hemoglobin, and then you're also able to deliver a large amount of energy into the skin at one time. And that energy alone will cause heating in the skin. And that also causes collagen stimulation. So results from IPL can really be beautiful, but there is this misperception that it is easy and it is oftentimes handed off to other members in the practice that may not have as much education on the nuance that goes with this device. And IPL burns are not uncommon because once again, you might be wanting to push the energy for one problem, but you're going to have the absorption for the other chromophore at the same time.
I have seen that myself, and it can take a long, long time for that to go away. And sometimes the treatment is more IPL, and that really kind of freaks people out because they don't like the results they got. And now you're telling them the best treatment is to kind of just keep going to even it out. But yeah, I absolutely totally agree. These are treatments that are everywhere. And so I think people get this false sense of, oh, it's so easy, no problem. Everyone's doing it. But yeah, I'm so glad you brought that up. Let's talk about some of your other favorite. Do you have any favorite lasers for certain treatment or energy based devices?
Yes, is the short answer. Probably one of my favorite wavelengths is the 1927 nanometer wavelength. And that has also become more common. Other laser manufacturers have come to make their own version of it because this wavelength treats so many different conditions. Obviously, you change the settings to treat one condition and your technique will change, but you can use this wavelength for many different problems. And it's a pretty safe device. So, in a sense that even if you have a potential unwanted outcome, it's not as serious as a burn from a laser hair removal or a burn from an IPL device. It's easier to manage. We use the 1927 nanometer for something called melasma, which is a pigmentation disease. I make it very clear to my patients that this is a disease. This is not something that we can kind of wipe off with a laser. It's an inflammatory condition that causes pigment deposition in the skin. And this laser can actually help melasma, whereas typically we're trying to keep energy away from melasma because we don't want to stimulate it. But this is when this wavelength is really unique. And it's because it is a non ablative wavelength. And when we deliver it in a fractionated fashion, so fractionated non ablative, you're not delivering so much heat in the skin at one time and you have a more controlled setting. But then you can really kind of dial up your settings and increase your joules, increase your density, and treat precancers. So people with a lot of sun damage, patients that have a lot of what are called actinic keratoses and that are really frustrating from a cosmetic standpoint, but also, slightly higher risk for the development to a squamous cell type skin cancer. So they need to be treated. This laser can do a great job, not only treating the precancerous change, but also making the skin look better. And Dr. Mina and I are fresh from a conference together where feel like every single lecture was on how skin that looks better and looks healthier is healthier.
Oh, absolutely. And it's healthier. It heals better. I do Mohs surgery. I see and treat a lot of skin cancer patients. And even today, I had skin that was just so thin and breaking and bruising. And yeah, like healthy skin is more than just looking good, too. It's removing those precancers. And I hear this every day from patients. What can I do to prevent these or prevent skin cancers? What can I do? Of course, prevention before it happens is the best. But then once you've already had sun damage, maybe you're in your 50s, 60s, 70s, whatever, and you want to try to reverse that. Yeah, these lasers can actually, there have been studies showing that they can be helpful. So again, more than just cosmetic, right?
Exactly. So much more.
1927 is a popular laser. What about the 1550 wavelength? Do you have much experience with that?
I do. The 1550 wavelength really is specifically collagen stimulating, also oftentimes delivered in a fractionated fashion, also non ablative. Doesn't penetrate quite as deeply as the 1927, but where it does penetrate is where you get a lot more collagen stimulation. So that's a great rejuvenative wavelength. Similarly, there's kind of in that same realm, 1470 nanometers is another popular wavelength that we deliver in a fractionated fashion for the same purpose. And these wavelengths can be used to treat dyspigmentation, but that's not where they shine. I will oftentimes pair a 1550 or 1470 with an IPL device, right? When I want to treat that surface dyspigmentation with the IPL, and then you want to get that collagen stimulation and good skin turnover with the 1550 or the 1470. But I'm trying to still keep the heat down. But when you really want that polish, then we turn to ablative wavelengths. And my favorite is the erbium, but another popular one is the CO2. And the target with both the erbium and the CO2 in the skin, the chromophore, is water.
Tell me more about those because I think sometimes the results from these can be phenomenal, right? But the downtime is also more significant, right? So, who's a good candidate for these resurfacing treatments?
Well, specifically, I'll speak on the erbium because the CO2 generates an enormous amount of heat in the skin, and that heat will cause more injury. Now, with that injury, you're stimulating a wound healing response and oftentimes a more dramatic improvement. But there's kind of a broader margin for complication, whereas the erbium does not cause quite as much heat, quite as much coagulation in the skin. So you're able to kind of mitigate your complications a little bit easier with an erbium wavelength. But some people will say, well, the CO2, you get more tightening. And the answer is you are right, right? You have to kind of determine as a doctor, how comfortable am I with that margin of potential unwanted outcomes, right? Or complications. So there are ways to have an erbium procedure in a fractionated fashion that very much speeds up your recovery process. That is really dials it back. There are manufacturers of lasers that do make really excellent fractionated erbiums that are pretty unmatched in the sense that you're able to give such dramatic results with very modest recovery period. But you're right, there's no way around the recovery period, but it is modest. When I'm doing full field ablation, so not fractionated, and when I'm explaining that to patients, think of fractionated as me treating a fraction of your skin at one time. I'm making these columns of highly precise laser-induced injury with intervening islands of unaffected skin. So we're able to treat the skin very deeply, but you're not wounded and you heal very quickly. But when we are doing full field, we're treating the whole area. And so as a result, the healing process is more pronounced. Oftentimes, I will actually pair the fractionated erbium with the fully ablative. So I will actually just kind of fractionate erbium the full face and then go back with my full field erbium to treat specific areas of concern, whether it's around the eyes or around the mouth, or just kind of lightly all over to really kind of boost their overall outcome. In my experience, patients are able to get a really beautiful outcome, but again, with a much more modest recovery period than if I had just, gone hundreds of microns across the entire face.
That's a great point also that you can pair these treatments, right? You can use different wavelengths at the same time to get the best result for patients. That it's not always one laser, one device, one wavelength that's going to do everything, right? And that's where really having this skill and knowledge like you do can pair nicely to give the patient the best results. So that's really neat. And yeah, certainly areas like around the mouth, like that can be a really stubborn area for people. And they usually need a little bit more intense treatment there.
hmm It's funny that you're bringing up the pairing the treatments. Probably the most challenging condition that I treat is acne scarring. These patients are all ages. I'll treat acne scarring in a 16-year-old. I've treated acne scarring in a 70-year-old man. And I think the main lesson here is that acne scarring causes an enormous amount of kind of psychosocial distress. And we need to treat acne as aggressively and effectively as possible because acne may be for a limited period of their life, but the scars are forever. And they are so complicated to treat. It is not uncommon for me to use a vascular laser or an IPL device, as well as a radiofrequency microneedling device, and then a fractionated laser, all in the same treatment. Because there's so many different components, it's so complex. Acne scarring is so complex that there's no one laser, no one device.
You didn't even go into things like subcision or biostimulants or filler, right? Like all of those can play a role too. So, yeah, that's a great point. It's so frustrating too that acne is considered a medical treatment, but the scars aren't. But yeah, I feel like if you are struggling with severe acne, like see your dermatologist because if we can nip it in the bud as soon as possible, and we do have good medications that will do that, we can save you a lot of scarring, right? Or minimize the scarring. Because to your point, that is forever and it can really affect people.
Well, you just brought up a good point that we do have some new lasers on the market that do treat acne. And target in the skin for these lasers is the sebaceous gland. And we're seeing some really phenomenal results. I actually invested in one of these devices last year. There had been kind of the first wave, but I never feel like I need to be first. I like to see everyone try things out first and then see if there's any complications, see if they really kind of deliver on their promises. And I did some research and had some close colleagues that were in doing the clinical trials on this particular device. I'm so glad I waited because the outcomes are remarkable. And I think when I'm explaining this to patients is that it's the first device that actually works on the same component of the skin that isotretinoin does, and which is, kind of more popularly known as Accutane, which shuts down the sebaceous gland. Well, these lasers target the sebaceous gland, specifically the hyperplastic sebaceous glands. So people don't have a problem with dry skin when they're done with their treatments or anything like that. It's just the hyperplastic sebaceous glands and really destroys them. And so it's a enduring treatment as well. So we do put it in the curative realm. And I'm always say that with caution, even with my Accutane patients. I don't know, 5 years later, maybe your acne will come back to some degree, but the longitudinal studies are very, very promising 4 and 5 years out from this particular wavelength.
And you can use it in all skin types, right?
That's correct. I've used it skin types 1 all the way through 6 without any reservations.
And I guess that's because, right, the target is not melanin, it's not pigment in the skin, it's actually those oil glands, what we call sebaceous glands. And yeah, I mean, I love isotretinoin. It's such a powerful drug for people who really need it. I had a lady today on it. And I mean, we were looking at her before and after pictures in just 5 months. It's really just amazing. But she's tolerating it pretty well, except her eyes are getting dry. And so we actually did bump down her dose. But yeah, to be able to offer a laser treatment that doesn't have those systemic side effects is really, really cool. So I love that. I think we'll be seeing more of that for sure. Maybe you can tell me, are you able to get insurance to cover this or is this cash?
That's right. Insurance didn't help me buy the laser.
It didn't?
I try to explain this to patients. I get it. I feel their frustration, and it's just kind of the model. And I think that we experience it in a very unique way as dermatologists because so much of what we do, the patients have a diagnosis that has an ICD-10 code, but the treatment is not covered, right? So we're able to kind of diagnose what's going on, whether it's their male pattern alopecia or it's their rosacea or it's their, actinic damage, but the treatments are not covered.
It's frustrating, but I think as people see more and more insurance paying for less and less medical things, that I think people will just be like, well, you know what? If I don't have to get blood draws and I don't have the side effects, it might be worth it.
I have my caution. I love Accutane. I think it is truly a miracle drug. I think that I see it as a truly life-saving medication because acne as well as acne scarring causes such, psychosocial distress, depression, anxiety, all of those things. And Accutane cures acne. It's a miracle, right? But like you said, there are patients that try it and cannot tolerate it. There are patients that maybe have done a course of Accutane, their acne has recurred, and they just can't stomach the idea of doing it again. They don't want, to have their blood drawn. They don't want to take a pill.
Or they want to be pregnant.
Exactly. They're of childbearing age and they're trying to get pregnant. So it gives us another option.
Tell me about lasers for basal cells. Or for skin cancer, I should say, right? Because as a Mohs surgeon, I get the patients all the time like, do I have to have more surgery? Like, can I treat this with something else? So can you talk to us a little bit about what that treatment involves?
Absolutely. So I will say that I love my Mohs surgeons. I rely on my Mohs surgeons, and we're referring for Mohs every single day from my practice. What this does is actually, these are basal cell carcinomas that are not what we think of as eligible for Mohs surgery. These are patients that I would otherwise be doing their excision right in my own office. So if it's over 2 centimeters on the body, if it's in the danger areas of the face, or really most anywhere on the face, I'm referring to a Mohs surgeon just because we don't have the data. And Mohs is still the gold standard. But for on the body, we're using what's called an Nd:YAG or 1064 nanometer laser to treat these basal cells, both superficial and nodular basal cells. And the clearance is excellent. It just hardly takes any time. It's under 10 minutes. Patients don't have stitches or wound to deal with. They can go right back to their activities. It's not like they have to refrain from heavy lifting or if it's on, if they have fists on their back or on their arms or their legs. I'm not risking lower leg chronic wounds that oftentimes take months to heal. It is awesome. Like I can tell you that so far, my patients have been so happy that I have the technology to treat these basal cells on the body.
So amazing. I remember I was back and doing residency when they were doing these studies, and I just thought that such a cool option. And yeah, I mean, I get asked that a lot on lesions that are not candidates for laser, but certainly Mohs is not right for everything. And when we do the scrapings on the skin, those don't leave the greatest scar. So if we can have a laser that just targets the pigment in the basal cell and doesn't leave a scar, and typically one treatment, right? I mean, how amazing.
It's been great. So far, we've been really happy to be able to add it to our practice. And again, no healing, no wound. And you reference the scraping or the what we call electrodesiccation and curettage, which just scars incredibly poorly. And I'll be honest, many of my patients, they will not accept a cosmetic outcome like that.
Sometimes it seems like, oh, that's the easier option. But then, yeah, sometimes just cutting it out, putting some stitches in is a better option. But yeah, again, it really depends on the patient, the type of skin cancer. But I do love that we have another option in our armamentarium for treating skin cancers, because as our population continues to grow, we're living longer, we're seeing just exponentially higher numbers of skin cancer. So I think that's great to have that.
It's great. And I'm so grateful to the doctors that did the studies with this wavelength. That is not an uncommon wavelength. We didn't have to go and buy a new laser to do this treatment. This, I do file with insurance for this, if you're wondering, Dr. Mina. So that's, I think, an added bonus. It's just another way for me to use this tool that I already have.
We had mentioned radio frequency microneedling before. I know there's a lot of interest in that. Who's a good candidate for that?
So that's a good question. I think, like many devices, we want it to do everything. And I think when the radio frequency microneedling first kind of came on to the stage for us, it was kind of, it can do this rejuvenation, it treats fine lines, it treats wrinkles. And in my experience, it does not do those things as well as lasers do. Okay, I'll be full disclosure. I prefer to use like a fractionated laser, whether it's ablative or non-ablative, to solve those types of problems. What I think it does extremely well is improving texture. So if you're kind of noticing some crepiness, it can sometimes be subtle, but crepiness in the neck area or on the chest, I think that's where it can shine. I also like it very much for like rolling or boxcar scars on the cheek area and the temples of the face. I think it does better than lasers in that area, especially if I'm going to come across right on top with the laser when I finish, which is pretty routine for me when I'm treating acne scars that are what I call textural scars, not just discoloration. That's where I think it shines. Again, I think that there was a lot of promises when the technology was first developed. No recovery period, wrong. Yes, there's recovery. And that can sometimes be 2 weeks of little red grid marks when you're treating at therapeutic settings. But, like anything, we have to be the experts on the devices, and the salespeople have their own narrative.
Well, and again, that's why we need dermatologists who really understand it and know what it can do, what the limitations are. And I finding, maybe you can speak on this, like sometimes people become so obsessed with, I need this device, or they've seen someone had this laser and so they want it. And I almost think it's less about the laser and more about whose hands it's in, right? For getting the best results.
I mean, I've bought the same laser. Does that make sense? Like, I felt the bottleneck was I needed another one of the same thing because I felt like really I didn't need something new and different. I really loved the very same thing.
Yep. And if it works, right? If it ain't broke, don't fix it.
Yes, absolutely.
What about microcoring? Now, again, we've sort of deviated, I've deviated off of lasers, and now we're talking about energy devices. But any experience with that? We have it in my office, and I actually really love it.
Yes. So I have a microcoring device as well. You and I should probably like talk later and share notes because it's a brand new device. We have had to figure out how to use it. It's come down to dermatologists like you and me that are really kind of making this device work or not work. And anyone else, any other practice in the country that decides to invest in this device is going to be looking to us to tell them how to use it. And I think that that was amplified to some degree with the microcoring device that we had to figure it out. I've really had patients that have said it's been the best treatment they've ever had, but the risk for scarring is there. So I do counsel on that. And I also now see, well, actually from the very beginning, I saw all patients back 7 days later, and I do like an IPL treatment on them just in case there's any hypervascularity. And usually there is. And it's the chance just for me to check and make sure everything's okay. You can tell my personality is wired a certain way. And the chance is kind of like look at them again. And I have had, I think, fewer scarring complications than most practices just because everyone gets an IPL at 7 days. And I think that facilitates healing and decreases that scarring. Now, scarring can still happen, and then I'm going to have to reach for a fractionated laser to fix it. But it is our only non-surgical option to remove redundant skin.
And it boosts collagen too, just like with the lasers that are creating that energy. It's actually, stimulating wound healing. So I think it can be, yeah, in the right hands, it can get really good results. And I think that's a great idea about doing the IPL after because you're helping the redness, you're boosting collagen, you're helping healing. So lots of cool things with that. I'll usually pair it with a peel that can work nicely too. So I've been enjoying that, especially for like around those barcodes around the lips. That can be really tricky.
I never thought I could fix lines with dots, but you can actually with the Eloquar improve that perioral area, and that was a nice bonus, right? Where I thought it would really do amazing. It's not been amazing, but then I've had these bonus areas where it's performed better than I expected.
Any other lasers or energy-based devices we haven't talked about that you just love and you wanna share with people?
Kind of an oldie that's got bad press because one famous person had so many treatments that it was really inappropriate. It's hard to beat cryolipolysis. And I've had so many patients be so happy with cryolipolysis. It's been around a long, long time now. Complications are really unusual and you can really avoid them again when you're using the device appropriately. And if you think about how many patients have had amazing outcomes and compared to the number of complications, it's actually very, very unusual. It's nothing like laser hair. It's nothing like IPL.
And you're talking about where the device that freezes fat to, yeah, slim, yeah.
Yes. So these are patients that have squeezable fat. And it's important to counsel patients that this is not going to lead to any kind of weight loss. But some patients do have what we call stubborn fat. And this will help kind of their jeans lie flat or these areas that have squeezable, squishable fat is typically on the backs in men and women, on the kind of mid back in men, on the kind of lower tummy area in women, and on the arms and especially in the submental area. I think it's phenomenal in the submental area. So it is permanent. It's permanent fat reduction in the treated area. So it's a liposuction alternative. Whenever we are able to offer a non-invasive surgical alternative, I think that's really our area of expertise. And we're saving them from, the risks of a procedure.
Very cool. Yeah, I've got lots of squeezable fat, and they make those devices to fit lots of nooks and crannies, don't they, nowadays?
There are so many applicators. It's amazing. Like so many applicators. And the applicators are what goes onto the body that has to be in the right shape.
It's cool. I remember, again, I was doing my residency when this was just coming out, and so we were playing around with it, and yeah, it, like, sucks your fat in and then freezes it, and then it looks like a stick of butter for a minute until it softens up.
We literally called it a stick of butter. Like that's what we called it. Yeah.
Yeah, so, well, it's very accurate. What about just because Ozempic, right? Ozempic face, all the GLP-1 agonists, it seems like everyone wants skin tightening. Are there any devices that you think are just amazing for skin tightening?
No, I don't think there's any device that is amazing for skin tightening. I think that you can get some subtle improvement with many, 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 many treatments, but it's subtle. For patients that have really dramatic weight loss and they have a lot of sagging skin, it's really this is a surgical intervention. We have sagging skin. There is no energy-based device that's going to tighten that up. It's just not.
Yeah. Well, I'm glad you're honest because, yeah, it's like if there was, I would have it and I would be using it, right? For sure. But yeah, sometimes it's great to be able to offer non surgical approaches, but there comes a point where we're limited with what that can do. And surgery really is the best option because you can spend a ton of money and you're going to get very minimal results. So, yeah, again, if you do have a lot of skin laxities, sometimes surgery just is the best way to go for those, significant results.
And back to like kind of the semaglutide face or GLP-1 inhibitor face, I do have to explain to people, I'm like, this is a weight loss face. It's not the drug, it's the weight loss. And weight loss as we get older is unkind to the face. There's different things that we can do to improve that.
Yeah, no, that's a good point because it's called Ozempic face, right? But it's not really the drug. It's just because you lose weight. It's so effective at helping you lose weight, and you can lose a dramatic amount of weight very quickly, and your skin does not have time to sort of tighten up and firm up. Any devices or lasers on the horizon that you're really excited about?
It's funny, right? Because when we're fresh from our, like, kind of our conference, usually I come with "Ooh, I really want that." But really, not so much. I think really the newest technology, the laser for acne is extremely new. I'm the only one in the Southeast that has one. And I think that it's going to become more and more common, and possibly other manufacturers will make kind of competing devices. That's so new to me, Dr. Mina, because it's a new target. Right, even the all the lasers that we were looking at, several weeks ago at our conference, they're all variations on wavelengths we already have. And so nothing that I got super excited about, "Oh, another fractionated erbium." Well, I have 3 of those. That wasn't so new. Now, that being said, the technology does improve as far as, safety, ease of delivery, and things like that. That is all happening, but really no new wavelengths except for acne. I think that's where things are real. I think that was really different.
That's a great point. We'd never had that wavelength before. So very cool. And yeah, I only know a handful of people who actually have it. So that's great to know that you have that and you're not too far from me. So, well, this has been a lot of fun. I've learned a ton and I know the listeners have as well. Can you just send us off with your top 3 takeaways for someone thinking about getting a laser or energy based device treatment?
Sure. Big takeaway is, what are your concerns? Like, what do you want to fix? Is it sunspots? Do you have an ongoing battle with melasma? Are you wanting to treat fine lines? Are you wanting to kind of improve your overall glow and dullness to your skin? Kind of think about what you want to improve, and that will help your doctor determine which device they reach for to solve your problem.
Great advice. I know people are going to want to find you, follow you. What's the best place for them to find you?
Probably on Instagram at DLC of Chapel Hill, which stands for Dermatology and Laser Center of Chapel Hill. But at DLC of Chapel Hill on Instagram is the easiest way to find us.
Awesome. Well, I will be sure to include that in the show notes, and I will see everyone next week. And thanks so much for being here.